This is related to when can I exercise after surgery. Patients often ask when can they get back to their activities after hernia surgery. And to answer this question, it's important to understand how exactly your hernia was repaired. Specifically, did you have stitches placed alone or did you have a mesh used? And this will affect how soon you can get back to all activities, though you may be able to gradually introduce certain activities slowly over time. So in general, it's a good idea to avoid any major activity for the first 2 weeks after surgery, regardless of the type of repair you've had. This allows things to heal. It allows things such as blood vessels to heal and minimize the risk of post-operative bleeding. When we place a mesh in the area to correct a hernia or repair a hernia, it has the capacity to shift ever so slightly in that first 2-week period before it's starting to really heal into place. And because of this, any strenuous activity could potentially increase recurrence rates, and it could potentially agitate the area or increase your risk of post-operative bleeding. After these 2 weeks, we can be pretty confident that that mesh has found its place, it's secure there, and at that point, when you've had a mesh repair, it's okay to start getting back to your normal activities. Still avoiding things that cause you significant pain as you do them, but otherwise sort of slowly approaching any of your normal activities and getting back to it should be safe. When it comes to a no mesh repair, especially in the groin no mesh repair, you've had several layers of stitches placed, and we're really relying on the strength of that repair, on the strength of those tissues healing together to prevent you from getting another hernia or prevent that hernia from coming back. So because of this, it's even more important with the no mesh sutured repair that you really take it easy even for 4 weeks after surgery. For the first 2 weeks, definitely just leisurely walking. After those 2 weeks, really being very careful doing anything more than that. And if you are getting straining, pulling, pinching sensation there with activities, just holding off for that 4-week period will make it more likely that your hernia heals to its full